Welcome back to Wave Listens Live. Joining me now is Dr. Reagan Ackerman from Freedom Mini Dental Implants. Dr. Ackerman, always a pleasure having you on the show.
Thank you so much.
You know, I know what you do. A lot of people who watch Listens know what you do, but for those who may not, tell us about yourself.
Yes, certainly. So I've been a general dentist since 2007, but in around 2017, I narrowed my practice down solely to what we call mini dental implants. A lot of people are like, what is a mini dental implant? So it is a smaller diameter implant. So it's a lot less invasive, less healing time, and usually a lot less costly than the bigger surgical implants. The great thing about them and why I've discovered them and love them is that it gives people an option that maybe couldn't afford the traditional ones, or maybe were told they didn't have enough bone for the traditional implants. Because it's a smaller diameter implant, I don't have to have as much bone. So people that maybe lost their teeth because of periodontal disease or gum disease, and they were told, oh, you don't have enough bone for implants. A lot of times I'm able to help people and tell them, yes, I can do implants on you. If you're struggling with a denture, we can, stabilize it, get rid of the denture glue, get rid of the floppy denture, ditch the denture completely, or if it's just one tooth that you're missing, or you're missing a couple molars, we can do that. And the best way to find out if you're a candidate for this is to call the office. It's a free consultation, and it includes a 3D x-ray. That way I can confirm that you have enough bone for the mini dental implants. So please call the office. Like I said, it's a free consultation. I'm the only dentist there. We're family owned. My husband works with me, and Lisa up front, who a lot of patients know, we all become family. She's been there forever. So please come visit us if you or a family member struggling with dentures or missing teeth.
And everything you say sounds good, but I know there's people like, okay, just show me. I might be able to see a little bit more when you do that. And luckily, you've brought enough models to show us everything you do.
Yes, because like you said, visual learner, I'm the same way. So this is probably one of the most common things we do is what we call a snap-in denture. So if you're struggling keeping your dentures in, I can place the mini dental implants, just local anesthetic. I do not have to sedate you. I don't have to take people off blood thinners. It's great. The great thing too is the day I put these implants in, you don't have to wait months to use them. The same day I put the implants in, I'll put these attachments inside your denture, and now you leave with the denture snapped on. So no more floppy denture. You can eat steak and burgers and everything you want, and you're just going to snap it out once a day and rinse and clean it.
And do you have to make the denture?
So a lot of people come in, I can use their existing denture. So if they like their denture, the aesthetics and the bite and everything, sometimes I can save them money and use their existing denture and convert it to a snap-in denture. A lot of times I can get rid of the denture completely. So I'll do what we call the permanent teeth, where place just more of the mini dental implants, but then we're able to make a bridge of teeth, okay? So no more denture, and this gets cemented permanently onto those implants. Huge advantage of this, especially on the top, then you have nothing on the roof of your mouth anymore. You get to taste all your food. You don't have to take anything in and out every day. You're gonna brush these just like regular teeth, get them cleaned just like regular teeth. So this is a great option to, the closest thing to getting your natural teeth back. And like you mentioned too, sometimes it's not the whole mouth. It could just be a single tooth, or maybe a couple molars in the back. You miss chewing food in the back. So if you were missing a single tooth, you had a sports injury or car wreck, we can replace a single tooth with a mini dental implant. Great thing is, I don't have to do sinus lifts or bone grafts, or if you were told you weren't a candidate, you could certainly be a candidate for the mini implant. Place the implant, and then the tooth gets cemented on permanently, so it doesn't come in and out. We can do multiple teeth next to each other. It could be 2 or 3 teeth. If you have a partial or a flipper replacing these teeth, and if you do, you know it because you hate it, we can get rid of it. We'll place the mini many implants, no stitches, no incisions, and then we're able to cement those teeth on permanently so they don't come in and out. And like I said, a lot less invasive and usually a lot less costly than the bigger surgical implants.
And we see what the implants look like. What about the people behind them?
Yes, so I love doing before and afters. So this was a great, this is Miss Melissa. She came in, had all her teeth taken out, thought she was gonna, or dentures were gonna solve all her problems. She could not tolerate her dentures. She could not wear them. So this is how she came to her office. She was not wearing anything, had nothing. She gave up. Of course, embarrassed. And so we were able to do snap-in dentures for her. And now that the dentures were snapped on to the mini dental implants, she could tolerate them because they weren't moving, they weren't flopping. She didn't have to use denture glue, and just increased her confidence so much because now she can smile, she can eat food, she can go out. She wasn't doing as much in public, and now she can go out to dinner and all those social functions again and live her life.
Yeah, just getting back to that normal. And
yes.
I think this is something that particularly stands true with this case as well.
Yeah, so this was Eddie. He came to me, so on the left in the black shirt, he had an ill-fitting denture, and he hated wearing it, and it was a little crooked and a little off, and he just didn't like it. So we did the permanent teeth for him, still kept his same smile, it's not aesthetically a drastic change, but in his mouth, how that feels to him, huge change. He has nothing on the roof of his mouth anymore. Those teeth are permanently cemented in, so he can, go eat hot wings now and chicken, and eat all those meats that he missed, and it's just so much more comfortable in his mouth, and it's been life-changing.
Yeah, and if these stories sound like something that you can relate to or something maybe a loved one relate to, you can get that free consultation with Dr. Ackerman at freedomimplants.com. Call the number on the screen, 502-937-4930. Dr. Ackerman, thanks again.
Thank you.